Well, I'm from the Santa Croce Carle Hospital in Cuneo, a little city in Italy. And the title of my presentation is Grief, Resilience and Advocacy, Call to Action for Italian Nurses During COVID-19 Pandemics. The aim of my study was understand the experience of nurses with respect to the concept of suffering, advocacy, and resilience during COVID-19 pandemic. A literature review was undertaken, and a single research and paper available through library database, PubMed and Google Scholar are considered there. The literature review focused upon edit volumes, journal articles, research reports, library database, and Google Scholar were used with the keywords, search using terms like such as compassion, nurses advocacies, nursing resilience, Italian nurses, nurses advocacy, and COVID-19 pandemics. Free full text, obviously, from 2020 2021, free full text, and from 153 overall, 21 papers were finally selected for review. Okay, what's happened? Okay, but what happened in 2020? Well, we know what happened in this year. We have seen different scenarios that we thought could only exist in movies and that instead become reality. In late December 2019, in Wuhan, Sainan, the Municipal Health Commission, informed that World Health Organization that a series of cases of pneumonia of unknown etiology caused particular diseases, and this new agent called suddenly coronavirus. These infections soon spread beyond the borders of China and affected all the world. And on March 11, the World Health Organization declared the outbreak and a global pandemic. But what happened in Italy in 2020? Well, the pandemic has severely tested the resilience of organization by bringing together the health emergency, market stress, and technological disruption in a single event. In fact, the fallout of the coronavirus pandemic has proved to be proof of the operational resilience of organization, highlighted the need to be prepared for the unexpected. In particular, on the 21 February in Italy, the first person-to-person transmission of the coronavirus infection, which caused the COVID-19 diseases, marked the beginning of an exceptional condition that becoming a national public health emergency. In Italy, in the month of March and April, there was in fact a huge request for care and assistance to infected people with several symptoms, who pour into hospitalization and care facilities committed to reorganizing themselves to be able to support the impact of the entire system through the enhancement of intensive care, the creation of dedicated departments, and the channeling of all professional resources into the care of positive patients. And the spread of this new form of coronavirus has strained the responsiveness and the resilience of the public and the private health system worldwide, but also the responsiveness and the resilience of the nurses and all the healthcare professionals too. But what about nurses? Well, The nurses worked at a frenetic pace of work, living with the fear of contagion, and with the fear of becoming vectors of infection for the loved ones, in strict compliance with the tiring dressing procedures. In addition, nurses have experienced of discomfort and helplessness related to close contact with pain, suffering, and the loneliness of patients becoming their only point of reference. The pandemic, in fact, has forced patients to distance loneliness and isolation from their loved ones to the impossibility of being worthily accompanied at the moment of death. This was so important. In our profession, nurses experience uncertainty in their practice. Uncertainty and the frustration are inevitably linked to the care relationship and the awareness of human finitude. These are limits that we are used to facing. The experience of overcoming the limits is the basis of our creativity. And this creativity helps nurses, help us understand and trust the meaning of existence into care. And the coronavirus pandemic that overwhelmed us like a tsunami has catapulted us into a different reality that has been resides in its anthropological and relational value. Nurses' experience was characterized by a multidimensionality of the conditional compassion, dictated by a profound loneliness in which the patient found themselves, by the multiple reflection of the gestures of care, and on the care relationship in whose dimension the end of life had become not on the themes, but the main theme that permitted the daily life not only of nurses, but represented the main theme of the existence of each individual. A compassion also determined by the abyss of the intrinsic uncentering of the pandemic self and by the moral dilemma that it itself unleashed. The pandemic soon became no longer just a health emergency, but a real relational emergency in which the nurse played a pivotal role, a compass in orienting the patient in the darkness of uncertainty and fear experienced following the infection. A synergistic parallelism has been created with patient and nursing, often forcing the latter to live in the same condition of solitude as the patient, far from their family affection. The helping professions such as nursing never lie in this high-touch situation with eye contact with COVID-19 positive patient, as required the nurses themselves an extraordinary ability to take charge of the pain of others, with an important relational asymmetry between nurse and patient. Compassion often exacerbated by constant organizational dynamism with different scenarios that opened with the moral dilemma, ethical reflection, contests within which a shared plan of care was not always possible, but only an emergency medicine, places in which nurses had to deal with together with other professionals, with the criterion of clinical reasonableness and with a soft utilitarian approach in the face of the scarcity of available resources. Many studies have shown the importance of advocacy the patient advocacy is an essential component of nursing care. Advocacy aims to represent and also safeguard patients' rights, best interests, and values, and ensuring that they being aware of healthcare and choice. The advocacy is a fundamental principle for the nursing profession, according to the recognition, human rights, according to the best decision making, and according to the empowerment of the person, of the patient. This is a particular picture that I choose. It is an Italian nurse, but it is a Brazilian nurse of the Amazonas states. It is very particular. For me, it's surely representative of the advocacy concept. In this picture, this nurse managed to persuade a patient with Down syndrome to undergo oxygen therapy, which is important for his survival. He managed to convince the patient with a hug, with a gesture of care, of protective care, particular and meaningful gesture, summary of many meanings. Well, many studies have shown also the importance of the concept of resilience. And this picture that we can see on in the slide is so representative. You can see COVID chests carried on army trucks. The crematorium was no longer able to keep pace with the deeds. It's so emotional to see again this picture, very so emotional. What about the resilience? There are so many concepts about this term. It is the possibility of transforming a painful or simple, stressful event in a path of learning and growth meets the theme of resilience. Often the resilient process has elevated the transformation of a care experience into a possibility of personal and professional growth, with important repercussion from an operational point of view, in the clinical organization, but also in the ethical and educational fields. Also in the second wave, in particular in the first wave of the pandemic emergency, the involvement of Italian nurses was a really call to arms, just like in a war. And this kind of recruitment had some effects on nurses, and this picture is surely representative of this effect. The pandemic showcased that resilience and partially its limits in some cases, but pandemics showcase a lot of suffering in nurses and not only in nurses. But an important thing is that an overwhelming and unexpected phenomenon appeared to support the development of resilience in the first week of March. In fact, the silence in Italian cities, because there were no cars, there were no traffic, was broken by singing. The windows in the street of the city were animated by people of all of age, enjoying the moment of social cohesion and of emotional exchange. Italians reacted quite immediately and spontaneously to address loneliness and distress throughout the use of singing and music from their windows. And often the songs were accompanied by applause for nurses and for healthcare workers. And this phenomenon was so important to support the development of resilience for nurses, but also for healthcare workers, but also for all people, all Italian people. Well, to conclude, so important, the global spread of COVID-19 has therefore put the responsiveness of health system to the test. The pandemic pandemic scenario have changed the paradigms of care, but the main assumption of nursing have remained intact. Nurses and health workers too then found themselves confronted critical situation leading to an increased risk of psychosis, distress, or other disease. And this experience surely highlights the value of nurses and nursing care for the healthcare system. And this experience, the COVID-19 pandemic, presented nurses with unprecedented challenges professionally, socially, and psychologically. And every aspect of care, delivery, and management has been affected by this health emergency, requiring nursing to work in a special, unique, and unprecedented ways to meet the demands of the epidemic. Indeed, there have been a plethora of stories from the pandemic describing nurses and other healthcare workers' extraordinary response to increases often overwhelming demand for acute care. But another important thing, what has still emerged from the study is that the feeling of compassion has exposed nurses to a high risk of emotional fatigue, defined by the literature as compassion fatigue, or a preventable state of exhaustion that manifests itself as a decline of physical and emotional energy, result from chronic exposure to the suffering by others, and to anger, helplessness, discomfort, and high stress. The COVID-19 pandemics, which has deeply involved our country, but also all the world, has confronted nurses with different scenarios of extreme suffering caused by both by the imposing number of the contagion and by restriction imposed and by clinical and organizational uncertainty, particularly accompanied by the epidemic peak during the first wave in particular way. And furthermore, this pandemic provides the opportunity to reflect on the resilience of nursing. Surely nurses are resilient, and this is so both as individuals and collectively. But don't call us heroes. Why don't call us heroes? Well, we nurses always experienced uncertainty and frustration, inevitably linked to the relationship of care and the awareness of the human finitude. There are limits that nurses that we are used to facing. The experiences of overcoming the limits is the basis of our creativity, of the nurses' creativity, which help us, we help nurses understand and transfer the meaning of existence into the gesture of care. Someone called us heroes last year, less in this year. But heroes cannot experience crossing the line because heroes have superpower. Nurses haven't superpowers. Then don't call us heroes. We are only nurses. Again, an important thing. This morning, during the presentation of Professor Natalia Sineas, there was a particular phrase that struck me, and the phrase is this: it is vitally important for nurses to tell our story, to impart the lesson that we have learned. Well, I think that the story of pandemic is a story to tell and to learn from. Thank you so much for your attention.